Professor Rifat Atun, it's very good to see you.
Thank you.
Here at the INSEAD Alumni Healthcare Summit. Now, you're the Director of Strategy, Performance, and Evaluation, that cluster in the Global Fund. So you're really concerned with kind of systemic growing diseases like AIDS, malaria, TB. How big actually is this problem? Is it getting bigger, or are we doing something?
It's a huge problem. These are pandemics affecting the whole world, all the less prevalent in developed countries, but affecting essentially the whole world. The problem is very large. For instance, there are almost over 30 million people infected by HIV, with over 2 million new infections each year. Around 1/3 of the global population have been infected with TB, but we have around 8 million of these become active cases each year, and around 2 million people die from tuberculosis. And with malaria, again, there are about 250 million infections each year, with around 1 million deaths, and majority of which are children. So these are really huge problems.
But do you feel you're making an impact? I mean, you're putting a lot of money into combating these. Are you getting anywhere with this?
Yes, actually, we're beginning to see evidence of impact. The Global Fund has been very successful in raising fairly large amounts of funds to date, around over 20 billion, around $21 billion, and have approved programs in 142 countries to an amount of around 16 billion. And over 50% of this money has been actively invested in countries. It's the countries that lead the programs, I must say, but we work as a partnership with all the leading institutions around the world. And what we're seeing is, for instance, in HIV, we're now seeing in a number of countries where we have intensive investment, the epidemic is flattening, i.e. the rate of increase in the new cases is actually reducing. We're also seeing a decline in mortality level, the death levels, number of deaths in countries. And in a number of countries, we're also seeing, in a particular group, for instance, women, pregnant women, which is a group one typically looks at as to look at the prevalence of HIV in the general population. In many countries, we're seeing declines, such as Ethiopia, and so on. So, good success story with HIV, but a lot of work needs to be done, because these are not by any means universal, but we're certainly moving in the right direction. In relation to tuberculosis, I think a critical success story is that almost 4.5 million people have been put on internationally or WHO approved treatment regimens within the last 5 years since the Global Fund inception in 2002, but the money really started flowing into countries in 2004. In relation to malaria, huge successes in terms of distributing preventative interventions, but using, for instance, insecticide-treated bed nets that prevent infections. And we're seeing huge declines in mortality levels in children and also in pregnant women in a number of countries.
Is there an area that worries you because you haven't got it quite under control?
Yes, I think geographically the success levels vary. I'm giving you illustrative examples. I mean, it takes time to demonstrate impact in each and every country. So in the highly endemic countries of Africa, many countries in Central Africa, we still have when we say we, collectively the countries and the development partners have a lot of work to do to ensure that we're able to control the epidemics and see declines in incidence and prevalence of these conditions.
Now, part of this has to involve making sure that the money, the goods, everything gets to the right place. So do you fund health workers? Do you have monitors in place? Because the areas you're talking about don't have really stable governments, or they might not have this problem, and there's a lot of corruption.
Yes, I think it's an excellent question. The Global Fund has an innovative governance model. So it's different to other multilateral agencies in that on our board we have donor countries that contribute funds to us. We have implementing countries around the world. We have private sector, the civil society, private foundations, as well as communities affected by the disease. And this structure is more or less reflected in country coordinating mechanisms which submit proposals to the Global Fund to access funding. And funding is then distributed through either the government or through a private sector or civil society organizations. Now, this innovative approach where you have dual-track financing ensures that the funding reaches parts where it's needed, because the governments are expressing, or the country coordinating mechanism are expressing in their proposals what they need to implement programs. It also involves multiple stakeholders. So not only are we able to fund health workers, we're also able to strengthen communities or community systems to scale up interventions. And for instance, we're currently in Malawi, we're funding a large number of health workers. Globally we're funding in many countries health workers, but in Malawi, a particularly large number. In Zimbabwe, we're funding over 15,000 health workers in the health system at the moment.
And where do you find these health workers? Where do they come from?
Well, in the case of Zimbabwe, they were the health workers that were in the health system, so there was shortage of funding. So through our programs, we're providing support. In others, again, it's the countries that use Global Fund investments to create incentives for workers to recruit new workers or to retain existing healthcare workers. A big problem in low and middle income countries is actually retention. So there's an issue with recruitment, of course, but retaining good health workers or health workers generally is a problem. So by creating incentive systems, we're able to retain these.
How does a country apply for funding from the General Fund?
We have windows whereby countries are invited to submit proposals for funding. To date, this has been once or twice a year. In fact, we're just completing our round 9, where again, a large number of countries have submitted proposals. So we announce the request for proposals, and there's a period of around 6 months when countries work with international development agencies or technical partners to develop these proposals, and these are submitted to the Global Fund. And we have an independent technical review panel that assesses the feasibility of these programs, also the technical soundness of the suggested programs, and also looks at value issues. And the technical review panel then makes a recommendation to our board, which ultimately then approves whether funding should be provided or not.
Is that a long process?
Typically, there's a 6-month preparation because these proposals are actually fairly large in the sense that one has to look at the existing need within the country, existing programs where the gaps are, then come up with a set of programmatic interventions to address these. So it takes quite a long time to put these together because these are literally national programs. They're large programs ranging from a few $1 million to several $100 million. So they are large. Then the approval process doesn't take that long. That's quite inefficient. In fact, the technical review panel retires to a hotel or to another setting and works very intensively over a period of 3 weeks to make recommendations to the board. And in between this recommendation and the board decision, there's around a period of 2 months where we see clarifications from countries on issues that have not been adequately highlighted in the proposals. Then there's a period of grant signing. Once a proposal is approved, there's a contractual arrangement between the Global Fund and the implementing entity, the government or a non-state actor. And that can take several months.
Now, where does your money come from? What is your business model? And where do you think the money will come from in the future? Do you see this crisis we're going through is changing sort of who's giving you money?
Yes, well, that's a $1 billion question, of course, if not more. Our funding comes predominantly from developed countries. For instance, the major funders of the Global Fund are the government of the United States, governments of the European Union, member states of the European Union. European Union itself actually provides direct funding, as well as many of the member states. in particular, such as countries such as Italy, France, the UK have contributed substantially, and many of the Nordic countries. In addition, Japan. But we also have private sector funding. Around 6% of our funding comes from the private sector, as well as private foundations. For instance, Bill and Melinda Gates Foundation is a major source of funding for the Global Fund. So we also have very interesting innovative financing schemes, such as Product Red. I don't know if you have heard of this.
No, please explain.
So a number of corporations, for instance, Starbucks, sign up to this initiative so that for each product that is sold, Gap is, I think, another one. Each product that is sold, a proportion of the revenue is accrued to the Global Fund, and that these monies are then used to invest in countries. There are other innovative sources of financing. For instance, a government may decide to write off debt for a developing country. For instance, Germany has done this with a number of countries. In return for these monies to be invested in the Global Fund, then invested back in the country, but against a performance framework. So funds are used to generate results.
It sounds like you have to be as innovative in terms of funding as you do with products.
Exactly. I mean, innovation is key, and we like to think that we're an innovative and learning organization.
Thank you very much for being with us.
No, thank you for your time, and thanks for inviting me.